Good afternoon, friends. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast, coming live to you from Columbus, Ohio today. And I am lucky enough to be joined by my friend Greg Townsend. Greg, happy to have you on.
Thanks for having me. I'm honored to be here, and hope your trip in was okay.
It was uneventful, thank God. Greg, for any of our listeners who may not be familiar, would you mind just sharing a little bit about your current role?
Yeah, for sure. So I'm at AltaMed Health Services, which is a lot of things. We're the largest group of federally qualified health centers. We have a great PACE program. We have an MSO, IPA, all the acronyms. We have them all. We have them all. And I'm the senior vice president, chief data analytics officer here. And in about a week and a half, it'll be 3 years. I'm from back east in Boston, but I moved out here 3 years to really to modernize their DNA offering, their internal DNA services, especially in advance of value-based care. So for the
Sure.
last 3 years, that's what I've been working on.
Yeah, I'm excited to talk more about it. I know when we met up, there was it's a lot going on. Not to get political, but like a lot of macroeconomic pressures, a lot of political pressures. You guys are a federally qualified health system to begin with, which has its own
Mhm.
challenges. But before anything, I do like to start the episode. I want to just have the audience learn a little bit more about your background. I really enjoyed learning myself. And we like to start the episode with just if there was one piece of actionable advice you might look to leave folks with today. I imagine there'll be a few, but if there was just one, what would that be?
Well, you can answer this question in a few different ways, right? So life-wise, it's a whole different thing. But when it comes to the business side of things, I've learned that the role of chief data analytics officer or anything of the data and analytic ilk. I read somewhere that there's the lifespan of someone in that role is like down to 18 months now. That is, it's a lot of turnover in this realm, and I think partially because of the topic I want to bring up in answering this question. It's about what value do you bring to the organization, and
Mm.
being able to bring value on a steady and consistent basis is really important. So we have the back office improvements that we're making in the organization around governance and quality and the things that are not very sexy. And then we have those roadmap items that are directly tied to operational or strategic success. And there is a regular drumbeat by which we demonstrate that value every month. There's a concerted effort to really unmask the things that we're doing. Sometimes they're behind the scenes and that our kind of internal customers can't really see it, but more times than not, it's something that because we put a lot of effort into making sure we align to the strategy of the organization first. So the DNA organization spends a lot of time thinking about things like value-based care, where UltiMate's going, and then aligning with the operations. So we have regular alignment sessions with our operations to see how we can make improvements in the operation that supports the strategic mission of the organization through data and analytics, and then cast a roadmap out for each of those customer sets as a result of that. But that's has been a real winning recipe for us, and through myself through the years I've been doing this is to demonstrate regular value, making sure that you're aligned to both the strategic mission, and the operations at the same time.
Yeah. You're above average, Greg. So that's great. 18 months,
Yeah,
you've dwarfed that now. So,
either that or the clock's ticking.
oh man. And just for everyone's awareness, the acronym DNA that stands for.
Oh yeah, I'm sorry. Data and analytics.
Okay. Yeah,
Yeah.
just um so Greg, I want to before we get into all the great work you guys are doing at AltaMed, I did want to spend a little bit of time and learn a little bit more about your background and kind of how you started out and how you got to the point that you're at in your career today. So maybe you could just share a little bit about your journey of how you've gotten to the position that you're in.
Yeah, for sure. And it's interesting because my son is just graduating college and starting his professional career, and I've been remembering that phase of my life a lot recently, and it's brought back some. Thinking back, it's brought back some moments of just pure luck with hard work. In the mix of those two things, kind of explain where I came from, but anyway, my first foray into healthcare was working at Concord Hospital in New Hampshire. I went to school in New Hampshire, and I had this dream of working in a hospital. I wasn't going to be a clinician, but I had this dream of working in a hospital for various reasons. And I was studying health promotion, and I ended up doing body composition screenings as a fellowship at Concord Hospital. So doctors and nurses, I'm doing the caliper test to see how much body fat they have. And through that, I got exposed to the inner workings of the hospital. I loved it. And then, life goes on, and within a couple of years, I'm down in North Carolina. And my first real job in the industry was working for the Blues Plan in Chapel Hill, North Carolina. And I started to understand the linkages between disease management, quality management from the health plan and provider side, just started to really feed my curiosity. And that's something that served me well. I'm a very curious person, sometimes annoyingly so. Moved back to New Hampshire or to Boston, got married, and then worked for Harvard Pilgrim Healthcare for a while. And in that, there was a serendipity moment there. I did some work for Joint Commission preparation in downtown hospitals in Boston. Got noticed by a CEO up in New Hampshire for a big health system called Elliott Health System, and I've led a demerger of medical groups and a very important Joint Commission um, accreditation for them, and things just took off. So I was the executive director and then VP of performance improvement, and the value of that first real executive level job was amazing. I was over my skis like nobody else was. I was really underprepared for that role, but in quality and performance improvement, there's not a corner of the organization in that hospital system that I wasn't in and I didn't touch. So I learned a lot about what drives success in an organization like that, with its people, with its patients, and its service. And ended up going to leaving there and going to Tufts New England Medical Center. Did a very similar job there, led a financial turnaround. And in those two jobs, as a non-clinician, what I could bring to the table was how to use data and analytics to drive improvement. And it was about that time that this whole idea of business intelligence, that type of thing, was budding, and that's what I was
Mhm.
doing. I just kind of backed into it by virtue of this performance improvement work. Flash forward a few years and a couple of jobs to Commonwealth Care Alliance in Boston. I spent 10 years building out their business intelligence unit. They had a nascent one at the time. They serve kind of similar patient population to what we serve it here at AltaMed. Very high risk on the margins, that people who don't typically have real good access to care, and built that out. I took it from really a very small, nascent data and analytics shop to something that really led their expansion, and with some great success. And moved on to Mass Health, which is the Mass Medicaid program. I was their chief data and informatics officer. Did a lot of the same type of work there. And then this opportunity came by, and felt really fortunate. Ultimately, it's a great organization. So I've been able to borrow from all of these experiences, and understanding both health plan and hospital operations has been really important to that trajectory.
Huge. Understanding both sides. On to be candid, I'm still learning all the inner workings of the payer side of things myself. Luckily, I have some people that are smarter than me sitting behind me, but wanted to double click into a couple things that you said because you started out mentioning that like you had gotten into healthcare for a few reasons. I know, like for me, for example, and I forget if we talked about this when we last time we linked up, but my mom was the president and CEO of a behavioral health nonprofit. Oh yeah, we did
Mhm.
talk about this,
Yeah.
right? So, seeing her have this impact on the lives of these women and children, um, and it's getting to see it start with one person at a time and then balloon into, thousands of people over the course of a year was very exciting to me. And at my last shop, I worked in a good amount in private equity, which was fine. It was good. I mean, a lot of opportunity, but the fulfillment that I've gained in working with healthcare and just playing a small role in having an impact on a patient's access to care or the experience that they're having is exciting to me. So, what was it that made you as a young guy, excited about getting into healthcare?
Well, I think it was you mentioned something I'll come back to in a minute is the your foray into private equity. I had a similar experience I'll touch on in a second, but that kind of codified my interest in delivery of healthcare. But that experience in Concord Hospital, right? It wasn't, doing the health education stuff was great, but it was really recognizing that people were coming there very vulnerable and in a completely stripped of any ability to control their outcome, and seeing these patient or these providers bend over backwards to do whatever they could to meet both the patient's needs and their family. I just fell in love with it. Just the ability to help someone at a moment in their life where they're incredibly vulnerable and helpless, and to some degree, and
Right.
to play a role in that was very attractive, and so that's kind of what sparked the fire in it. And like you, I've had some experiences in the payer side, and at one point I worked for a for-profit organization out of Chicago that does revenue cycle management. And the title of my job was at Dartmouth Hospital, which is fantastic. But the title of my job was clinical partnerships director, right? And it was the furthest thing from what it was. What it was a way to enhance revenue and at the organization. Very important, especially for a not for profit. But I was really good at it, but I hated it. I did not like the fact that I was so many generations away from doing what I could to improve patient care and outcomes. I spent a lot of time with the
Mm.
clinical leadership talking to them about that, and not enough time in some cases talking to them about the financial underpinnings and opportunities. So it's definitely something that I feel in my bones. I think it started in that hospital, uh, by getting at a firsthand experience with it.
Yeah. Yeah, I get that. The other thing that you touched on that I really appreciate was you're humble enough to kind of share that when you started that position, when you were kind of getting up to the VP executive level at that first time you got to that level, that you felt like you were over your skis. I think I heard you say,
Oh
and
yeah.
as an entrepreneur, um, and someone who has admittedly struggled over the course of my career with imposter syndrome or feeling like I was over my skis. I just wanted to call that out because here you are as the chief data and analytics officer. I'm not doing too bad myself as a entrepreneur, and I think there's so many. or my experience is that there's so many things that when we first step into them as a new role, because I mentor some people now too, and I just have friends and colleagues that'll be like, David, I don't know what the fuck I'm doing. Like I stepped into this role, like, and it's like you were hired for a reason, right? Like you have a base of knowledge that is inherently of value to the organization. Everything else, I've had to go and figure it out, right? Like that's
Exactly
part
right.
of it.
Yep,
Uh,
ex
and
exactly right,
so
David.
I just wanna shout that out because I think it's an important thing for if anybody's struggling with, feeling that they bit off more than they could chew or that, like, am I meant for this role? It's like, take a deep breath, lean back into the people you know and love and trust, your circle, and then just get after it, you know?
I completely agree, and and this is a discussion I was having with my kid. Feeling like, "Well, I'm underqualified for that," and everyone thinks that. And even when they get the job, they worry about that imposter syndrome. And I found that, remaining curious and most important in my experience, in this industry, probably any industry, is being able to communicate well with people and to
Mm,
really connect with them. That really helps a lot to understand what you don't understand, the relationships that you are able to create and maintain with folks, feedback in that. And so I think the curiosity to I remember the first job I took, the title of the job was I think it was down at the Blues Plan was risk management coordinator. I didn't know what risk management meant. I called a hospital before they offered me the job. I called a local hospital at UNC and said, "What does risk management mean?" So I just I mean, just to stay, I had confidence enough in myself that I could learn it if I wasn't equipped with that knowledge to begin with. So it does take a little bit of intestinal fortitude and a
yeah.
healthy dose of curiosity for sure.
Yeah. Yeah, courage, really.
Yeah.
And the other thing that kind of dovetails into what you're talking about for me was, I mean, you mentioned like communication and human connection. And my experience has been that the more that I focus on human connection and being of service and not in a self-serving way, right? Because I did that too for many years, right? And was consumed by fear of
Mhm.
losing what I had gained or not getting what I thought I needed. It was in and like I still have today, reasonable, I would call it fear, right? Like my daughter's sick and really, really sick, and I don't know what's gonna happen. But the truth of the matter is when I'm consumed with fear, it affects my usefulness to others, right? Which is, it's not particularly helpful, right? So I've had to learn how to move through fear, like feel the feeling and then move through it. And in doing so, and in kind of refocusing, kind of like you mentioned on connecting with other people and like and not just I it's funny, we were just quickly, like, my daughter and I went to a swimming lesson on Saturday, and when we check into the Y on, Saturday afternoon, there's always this guy, Orlando, who's there at the desk, and, like, I guarantee that, half the people that have been going to that Y for, 5 years don't necessarily know Orlando's name, but we like, I took that opportunity with my daughter, and we talked with him for a minute, we talked about vacation, we asked him how he was doing, and, you just saw him light up and, you know, in a it was a positive moment, and we were walking down the stairs, and I just told her, like, it's great to try to connect with people and be kind to people
Mhm.
throughout the day, and as I say it, like, when I was a young guy, I might hear that and think that that's trite or like, "Oh, yeah, well, yeah, of course you're kind to people," but, like, I had to get very intentional about it at a point in my life, and I'll tell you, the more that I've kind of now it's just kind of second nature, but, um and it's a practice every day, right? It's not something where I've just, like, been enlightened now, but I'll tell you, I don't struggle with fear nearly as much as I used to in my early days, and that makes
Yeah.
showing up and doing business, having difficult conversations, dealing with a multitude of different types of, issues that arise in healthcare or as an entrepreneur a lot easier.
Yeah, for sure. And that lesson that you're giving your daughter in that moment with Orlando is an amazing gift that to teach someone that, and then eventually you'll see that pay off, and that's just, incredible. But I agree that fear is a very poisons the well of your soul, so to speak. And I've spent a lot of time thinking about that, and I very much believe I've always been someone who believes that you see what you look for, and that's
Mm,
might sound silly, but it really is. It's all about perception. If you're
right.
wandering through life fearful of everything, that's all you'll see. It's things around you that scare the hell out of you. And being able to accept the fact of, wherever you are, however uneasy that might be, and just focus on the things that you can do in front of you to be good at whatever that is, helping your kid, doing your job, whatever that is. The rest will come or go without your control. You don't need to control
Right.
everything. I think that's
Exactly.
a very important lesson for people to learn. And sometimes, Dave, it's great you learned it as young as you are, and sometimes it takes people their entire life to learn that lesson.
It I brought up this book on the podcast before, but there was this, book, From Strength to Strength by Arthur C. Brooks, that was
Uh-huh.
it, and a Harvard guy, about, like, the striver's curse and these people that go to their deathbed, and they were just so consumed with, like, getting that next thing or controlling and gaining, and, like, they're just like, uh wish they would've looked for that love and that human connection and that fulfillment in a different way, right? Because
For
the
sure.
truth of the matter is that once you get a certain age too, like, you're not that same person as you were at the peak of your career, right? You start going in a different direction. You have immense experience. So if you can shift towards, like, as opposed to trying to strive for yourself, like, how can you bestow that experience upon a team of people, right? Or become a more of a teacher, if you will, right?
Yeah,
Um, it can not only be incredibly impactful for whatever organization you're serving, but also very fulfilling as a leader
for
too.
sure. For sure. I've spent some time teaching in universities. To be
Oh,
quite frank, to attract candidates, it's very hard to recruit for analysts. So I went back and took an adjunct professorship to do that. I got a lot out of that.
oh,
But
that's cool.
most importantly, as a leader, I think I'm well described as a servant leader. And I work with some amazing people that I've been blessed to work alongside and have work for me. And I invest a lot of time in developing them, and I get a lot out of that. It's part of what I get out of that are very dedicated employees that
Right.
are going to work hard in a common direction, which I think sometimes you get too late in your career before you figure out that the key that turns that lock is sharing the knowledge that you have with the people that are working for you and with you. That definitely pays dividends.
Yeah. Well, I gotta tell you, I mean, and I wanna dive into some of the work that you guys are doing at AltaMed. One of the biggest enemies to innovation that I've seen in healthcare in particular is a culture of fear. And what I mean by that is I've seen executives, right? Or, maybe not at the C level, but sometimes at the C level, sometimes maybe a couple rungs down
Mhm.
with thousands of people effectively under them, uh, that have propagated this, we need it done. We need it done yesterday. Why isn't it done yet? My ass is on fire, right? Like, and it's just, and some of that, right? I mean, has been warranted in a sense, right? Or at least understandable, right? You had everything going on with COVID. You have again these macroeconomic pressures coming
Mhm.
federally and otherwise. Like there's a lot going on in healthcare. But as a leader, I think the part of the mark of a good leader versus someone who's just managing people is the ability to feel that pressure and not let it manifest into stress such that you are passing that on to your team like a disease, really. Because when my people start being infected by that fear that I'm clearly feeling, um, they they get fearful of making the wrong decision. They get fearful it creates this level of inaction and friction that they're kind of looking over their shoulder, they're trepidatious, they don't wanna make a mistake, and to try to innovate where, the innovation is this accumulation of these seemingly small decisions to get, and iterate and improve, very, very difficult to do that. So,
I agree, and I don't think innovation and fear lives in the same space for very long. I think that's exactly what you're saying there. And I feel like, where we are at AltaMed right now is we're in one of those moments where that metal is being tested. So that we're on this path to move from um, fee for service to value based care. A lot of the disruption at the federal and the state level, with some of the new bills that have come out and challenging our finances, the financing of healthcare right now on a macro level, um, challenges that commitment to value based care, and it is something that I'm proud to say that we've kind of held fast on that to see our way through this, and sometimes it means that you do need to focus on some get it done now things, right? That always happens, but I think it's you put that in context of your commitment to a larger strategy, so the people that are working for you can understand that this is a moment. It's not the fact that we're changing the direction that we're heading in. I think if you do end up tacking in every direction or any direction that comes out of fear, by virtue of doing that, you don't have any direction. You're really shifting it at the whim of the wind, and I think that's a dangerous thing to fall victim to.
yeah, no, agreed. And it makes sense. I mean, like, you have to, like, particularly in healthcare, act with urgency or, there's things that require a level of, well, urgency, but
Yeah.
and at the same time, I mean, I think the way that even you just described it and the way that I imagine you would lead through something like that just instilled a level of confidence and trust in me in that moment, right? And I think that's what I was trying to get at is that, as a leader, how am I, um, feeling that, acting with urgency where appropriate, still remaining strategic. It's tricky, right? But it takes work, I think, and it takes, kind of that self-examination. I mean, you mentioned earlier being curious, right? I think for me, one of the big lessons also was uh, achieving a level of humility such that I could constantly be learning, right? And
Hmm.
I've said it on the podcast before. The older I get, the more that I learn, but the less I realize I know,
Yeah,
which is
that's definitely true. That's
a
definitely
funny
true.
funny paradox there, but it's true, right? When you see the world, the vastness of the world and everything, it's just
I would
you
argue, Dave.
realize
I would argue, David,
please.
that's wisdom, right? Just what you said
Mm,
there is what wisdom actually is the understanding what you know, and the fact that you don't know other things is exactly what wisdom is. And I do think from time to time, especially with the changes that are occurring in our environment today with AI and some of these new bills that have come across, it's just a wave of information that you need to sidle up to really understand the impact your organization is unbelievably large. and
Mm.
trying to kind of decipher what's the signal and what's the noise in all of that is difficult, but it does take some time and a considerable amount of curiosity to not just turn away from it and say I can't deal with that, and I'm going to stay operational and move away from strategy. I think that's especially right now, it's very hard.
So, Greg, I want to talk a little bit more, like I had mentioned before, about the work that you guys are doing at AltaMed. But
Yeah.
before, we always just like to ask favorite book or literary piece, either all time or that you've read recently. Anything that you'd like to share with the listeners there.
Yeah, boy, that's a good question. My brother just sent me last night, actually, a good heads up. An author called Andrew Roberts. And the book is just called Churchill.
Hmm.
That I'm gonna go get. I trust his instincts. But one of my favorite authors is Eric Larson, who writes a lot of nonfiction. And one of the best books I've ever read is a book from him called The Splendid and the Vile. It's just a fantastic account of Churchill in early 40s, 40, 41, as Europe was going into World War II. And there's some of the things that were going on in his personal life, and of course his first foray in being a prime minister there, and some of the pressures that he had to deal with. And talk about fear. I mean, just a man who is just overwhelmed with a lot of pressure, and the way he kind of navigated that was really impressive. And what I love reading about him. I think he's an interesting character in history. On the personal side, kind of the professional, or sorry, the self help side of things. And we've been talking a lot about fear today. Is a
Yeah.
book that's called "The Places That Scare You," and it's by a Buddhist monk, and she's called Pema Chandran. And I'm looking down at it right here in front of me, and it's an excellent book. It's a quick read. It's principally about some of the things that we've talked about here. Is how do you manage yourself through difficult times? And the message in that is principally about perception, managing the perception of things, and put it in realizing how much you can control uh, some of the things that scare the hell out of us, and that there's peace in that. So, yeah, but bar none, Eric Larson is one of my favorite authors. If you haven't read Devil in the White City or anything by him, and there he's an amazing author.
See, I mean, and it's part of the reason I do this is I get to build my book list. But you know, the the fear thing, and the perception thing, it's just been so huge for me. And I'm gonna get off it now, but the last thing that I'll say is, gratitude, right? Like, I mean, for me, uh, waking up today is a gift, right? It's not a certainty, right? So my perception of things today is that this day is another gift, right? And there's going to be things that are going to happen. But and I think we might have talked about this when we met. Like, I don't really know what's effectively good or bad, really, because some of the hardest or most difficult things that I experienced personally or professionally, uh, turned out to be the catalyst for a perspective shift that ultimately shaped the trajectory of the rest of my life, right? And if I
Yes.
would have gotten what I thought I wanted in that moment, I would have been selling myself way short.
Yeah, it's you really don't know. I mean, I think that's the universal truth is that we think we do, but we really don't. We don't know. And if you come into it with that expectation that in the face of really horrible things that look terrible in the moment, you don't know what's going to happen. And spending a lot of time living in anxiety is not.
It's not. So, anyway, thanks for humoring me there.
Yeah, not at all. Good topic.
It is. It is. I've gotten good feedback from people, from our listeners, that, not having to be all tech or all healthcare or all whatever. is actually is useful to
Yeah,
folks,
for
and
sure.
it's useful to me too to talk about because, like I mentioned before, it's not something that for me I've arrived and now I'm enlightened. It's a daily
That's right.
practice, you know.
That's right.
Um, so 3 years, nearly 3 years at AltaMed, Chief Data and Analytics Officer. You guys are, uh, you know, trending towards, moving towards a value-based care model. Talk to us, Greg, just a little bit more about, your vision, maybe some of the key initiatives that you guys are working on. Anything you can share with us kind of in more detail about the, kind of meat and potatoes, data and analytics, that kind of thing.
Yeah, I'll tell you about the vision first and then some of the initiatives. So I think the vision, as we talked about earlier, follows the strategy of the organization and the operational needs that are associated with it. And the vision I think is to be able to provide access to care to people who um, don't really have access to primary care
Mm,
and in other types of care in a way that's really effective. And I think that's kind of the meat and potatoes of very simply what the mission is. It is a grand mission that our CEO has been at for now 56 years, going on 56 years in September, starting in a barrio clinic that that was tiny and has grown it into this billion-dollar organization that serves the margins of people at risk, or the people at risk at the margins of our society, and it's been effective. So that said, from a DNA perspective, is being able data and analytics perspective is being able to understand the inherent risk associated with a group of people that have needs for primary care, to understand what that those needs are very specifically, what they are now,
mm,
and what the rising risk will be, 1 year, 2 year, 10 years out, and then be able to titrate the amount of care or the types of care that to meet the needs of that either apparent risk or rising risk is really what we're trying to do from a data and analytics perspective. So we create risk models and look at our current population, try to predict what that population is going to need over time, and then spending a lot of time examining our actual care model. How do we create the best interdisciplinary care team that provides the right care to the right person at the right time? I think there's a lot of waste in healthcare in not answering that question. And that doesn't get answered appropriately. We create issues with access. We create issues with affordability. And I think that's where the magic of value-based care is that it does help, or it does call an organization like UltiMed to titrate its services to the ones that need it most at that time, and then provide access and availability to patients who don't have that risk, but they want to stay there. They don't want to have rising risks. We want to keep them healthy. And there's a lot of data and analytics work that are driven through that strategy. A lot of risk stratification building that we're working on, and then evaluating models of care that are highly effective to help people avoid seeking care in the emergency room or staying out of the hospital by keeping them well. Really, really important, and doing it in a way that's respectful of their culture and their all sorts of social determinants that they have when they seek help with us. But to the some of the things that we're focused on, and at the top of the podcast, I was talking about some of the things that are not very sexy and those things that are really eye opening. I think that's something that's true of anyone in my role, or for that matter, anyone in data analytics. That we have this kind of shared responsibility between the back office fundamental things that are just the blocking and tackling of proper data and analytics that you've got to pay attention to. And one of those things right now for us is really moving the needle on data governance. We have a complex
mm.
organization with data that resides in some of the partner companies, and trying to align all that and govern it the right way, and to create scalability out of all that gets driven through these data governance needs. And then on the more kind of aligned with the strategy side of things, all of these value-based care initiatives that we're working on, and that's inclusive of building risk models. And it started when I got here with answering some really fundamental questions about understanding just descriptive analytics about where are we spending the medical dollar? Where is it going to? And what are the reasons why our patients are seeking those services? Which providers are really effective at doing that? It's that fundamental analytic question that we've been answering, and then building the analytic tools to do that has been we've launched arguably too many analytic dashboards and reports out into the organization to really help describe all of these different angles to managing value-based care. And going into 26, we're thinking about how do we principally organize those things to give the provider in the practice a better 360-degree view of their patient's care needs. There's all sorts of angles that the clinician is thinking about when they're sitting in front of a patient. And it's our job to, from a data and analytics and technology perspective, to try to tee up that information in that moment of contact with the patient, so that the provider, the clinician, can make a good decision about some of the things that are really going to make the most impact on that patient in that time.
Yeah.
Yeah, those
Yeah.
that's what we're working on.
Just that.
Just that, just that.
And you mentioned the data governance. Is that same group of people starting to dip their toe in the water in regard to AI and all of that as well?
Yeah, so through all of this is a thread of AI for sure. And so you know, we've stood up an AI governance practice and council that's trying to really understand where our opportunities lie for both generative and agentic AI opportunities. And we've already started. This got led through my colleague, the chief information officer, Ray Lowe, who is amazing.
Yeah.
Brought in an organization to do ambient listening an AI tool to do ambient listening in the provider practices. And it's just been wonderful. The adoption curve was exponential. The docs absolutely love it because it provides them an opportunity to engage with the patient while they're in front of them, not worrying about all the different things that they may have to document afterwards. They can be present. And this ambient listening tool is understanding and transcribing that encounter, and then playing it back with a lot of additional insight and information opportunities for the clinician in their pajama time, right when they're at home doing some of the documentation, that they got to recall all that stuff. And this tool, this ambient listening AI tool, has just been a winner in terms of improving our documentation, teeing up some ideas for our clinicians that might improve patient care or the way that we need to document their care. Has been big. We're also looking at other operational, you know, opportunities to evolve AI. I will say, just on that note, I do think there's a healthy amount of skepticism, not just at AltaMed, or not only at AltaMed, but I think across our community of provider organizations, that when it comes to AI driven clinical decision making,
Mm.
still really needing to kick the tires on that a lot. So there's a lot of watchful waiting, trying to figure out where the regulations are going to go with this, and what types of use cases are responsible for an organization like AltaMed to engage in. And we spend a lot of time talking about what's responsible. and what's advisable and what is our risk tolerance for these types of
Right. Yeah. No, for sure. I mean, we've talked about already some of the biggest challenges that you guys are facing, but um, expanding on as an organization, what are some of the challenges that you're navigating either in your role or the health system as a whole, that you might share with everyone?
Yeah, I think I couldn't get out of here without mentioning the healthcare financing issues that
Mm,
are coming up. It's just they're shifting sands literally under our feet right now, and it's creating a lot of unknowns. You know, where is this going to land? What does Medicaid and Medicare funding going to look like? How is that going to drive opportunities like value-based care? Well, not just at UltaMed, but across the nation are things that right now we're trying to unpack. And that's a big challenge for us right now is we're starting our 2026 strategy planning, really having enough information about where is this going to go, you know, 1 year, 2 year, 10 years out, and how does that impact our desire to move to value-based care and to grow. I think that's our biggest challenge right now, and that does get trickled down, right? So that's that certainly at the macro level. But look, it impacts, you know, my budget from data and analytics function too, and what we can invest in. So, you know, we're spending a lot of time trying to stay ahead of the curve. For instance, you know, the redetermination changes as patients are going to have to be requalified for Medi-Cal. And what is that
hmm
going to mean in terms of continuity of care for patients? What is that going to
Right.
mean for you know the impact that that's going to have? That one thing is going to have on our operations um, is really an open question right now. So we're spending a lot of time analyzing that, trying to understand what are some of our options, and being smart about acting first in a way that's going to maintain our commitment to our patients. And I think that's the driving principle behind all.
Yeah. No, 100%. I know so many, you know, colleagues in similar positions, and it's tricky, man. Um, there's no easy way to say it other than that. But anyway, so Greg, we're coming up on time here. I mean, it's been a fantastic conversation. Um, the last question I always like to ask my guests is, if you could go back 5, 10, even 15 years in time, what advice would you give your younger self?
To fly fish more. So, so I, you know, I'm almost serious about that, and it's a little tongue in cheek, but I think it's what it rep with that reference. I'm a fly fisherman. I get a lot of energy and this is huge stress relieving activity for me, swimming and
Mm,
fly fishing. And when I stop doing that, it's usually a good leading indicator that I'm taking my job way too serious
mm,
and that I'm not, you know, maintaining the balance in my life. And sometimes that happens, right? There are periods of time where you just need to do that. And other times it's not. But I did go through a period of time, probably 5 or 10 years ago, where I set aside a lot of things I wish I had not set aside to accommodate some things that I thought were high priority. And they were very important. They remain important. But as you said about your colleague, I think he said it was at the end of their life. Are they going to look back and talk about the board meeting they went to, or the dinner they attended, or is it the time they would spend with their family? You know, going to the beach like you did this past weekend, or fly fishing with my son. So yeah, definitely maintaining balance is really important.
yeah, you can't pour from an empty cup,
That's
as they
exactly
say.
right. Exactly.
Um, Greg, absolute pleasure, man.
Yeah, likewise. I
Psyched to,
enjoyed it.
yeah, it was great. Looking forward to seeing you again soon out west, and To our listeners, thank you all for tuning in. We will catch you all next week.
Well, thank you.